Welcome to the Power in Motion podcast, the show for women who want to develop a kinder relationship with their body so you can feel healthy, happy, and confident without restricting food, doing torturous exercise, or constantly worrying about the number on the scale. I'm your host, Kim Hagel, size-inclusive fitness specialist and certified non-diet health and life coach specializing in body image. This podcast is here to provide weight-neutral, health at every size aligned information and coaching on sustainable habits and mindset shifts so you can feel your very best in the body you have right now. Let's lace up our runners and go for a walk while we chat. Well, hey there, how are you doing today? Welcome to the Joyful Movement Show. You're listening to episode 32, and today we're talking about returning to movement after pregnancy. I'm your host, Kim Hagel, personal trainer, registered holistic nutritionist, and I'm on a mission to help women find confidence in their now body through intuitive movement and eating. And it's no secret that the postpartum period is full of changes physically, mentally, and emotionally. And a lot of women really struggle to accept themselves or their bodies during this time. And that can lead to dieting behaviors or over-exercising or engaging in intense exercise that we're maybe not yet ready for, and only adding to the shame and pressure and confusion that we already feel at this time. Our guest today is an expert in non-diet pre- and postnatal fitness. And she's all about helping pregnant and postpartum people to feel their best inside and then move joyfully from there. Jessie Mundell is a kinesiologist, fitness educator, and fitness coach specializing in prenatal and postnatal exercise training. Jessie is the creator of the Postnatal Fitness Specialist Academy, Core and Floor Restore, To Pregnancy and Beyond, and co-host of the To Birth and Beyond podcast. She's focused on effective exercise during pregnancy and postpartum, rehab of the core and pelvic floor, and C-section recovery. Jessie teaches people how to exercise safely and strongly in pregnancy and how to regain their core, confidence, and fitness as moms and parents. Jessie has worked with hundreds of women during and after their pregnancies and is extremely passionate about giving them the care they need. She also runs a certification program for hundreds of trainers and health professionals who want to learn methods for training postpartum clients. She aims to steer the conversation away from the pre- and post-baby body madness and into a place where women feel supported, encouraged, confident, and strong. In our conversation today, Jessie and I chatted about the pressures new moms face to get their body back and how that affects their physical, mental, and emotional health. We talked about how moms can feel better in their bodies without focusing on fat loss. Jessie shared some tips for how you can make the most of your limited time for movement, what to focus on, and how to safely progress. And finally, we talked about how we, as fitness professionals, can best support pregnant and postpartum people by supporting the whole person. So here's Jessie. Well, Jessie Mundell, welcome to the Joyful Movement Show. I am so excited to have you here and to have a really interesting and in-depth conversation with another non-diet professional. It always just lights me up to meet another non-diet fit pro. So welcome.
Thank you, Kim. Thanks for having me.
My pleasure. Well, one of the first questions I always like to ask our guests is to share a little bit with us about your own journey in discovering joyful movement, or what joyful movement means to you.
Oh, I love that. It has been a long road for me in discovering joyful movement. I am a fitness professional and kinesiologist, and I have a long history with an eating disorder as a child and disordered eating. And I used exercise as a tool to control my body for many, many years. And the last time I consciously decided I was going to stop restricting myself in terms of food and making exercise be a thing that also restrict me was almost 9 years ago. And since that point, I've really just been trying to discover what it is I want from exercise, what it gives me, how it helps me in my life, and as you said, what is the joy that I can take from it? How can I continue to detach my physical body composition from the movement that I do? And that has been like I said, my process over the last 9 years, and I have never been more comfortable and at ease in my body. And that has been going through during this time period, 2 full-term pregnancies, 2 cesarean recoveries, breastfeeding 2 children. And yeah, through it all, it's just been really such a process to witness my body through it and to not try to control it.
I love that. And it is such a process. You're 100% right. It's not an easy thing to let go of all of that pressure, but when you can, there's so much liberation and joy to be found. So thanks for sharing that story. So then tell us a little bit about your work. We know that you are a fitness professional and you specialize in helping pregnant and postpartum people. So tell us a little bit about how you came to adopt a non-diet, weight-inclusive approach to postpartum and pregnancy fitness.
Yeah, I think ultimately I realized that I was making my clients' experience in their body worse as a fitness professional. And that was really eye-opening for me. It really came from my own, unlearning about my body stories and my own learning about diet culture. And I realized that I was feeling so much stress about my body. So, of course, my clients were also feeling so much stress about their bodies. It was in the way I talked about food. It was in the way I talked about exercise. It was how we were taking measurements and photos of their bodies and the conversation that took up every training session or the majority of training sessions. And people were just really uncomfortable with their bodies most of the time. And I wasn't changing that for them because I was perpetuating that for them. So I eventually just decided we were going to stop doing those progress photos, quote unquote, progress photos. We were going to stop doing the measurements. We weren't going to talk about food anymore. We weren't going to talk about body change anymore. And it really just became this line in the sand that I drew. And, some people didn't want to work with me anymore, of course, but the majority of people did. And they wanted to also feel differently in their bodies. They too didn't want to feel like they needed to control themselves anymore. And that has been so important in the continued work that I've done with moms, pregnant and postpartum people, to help them enjoy their bodies throughout these years that can be filled with such transition and such struggle. They don't need the added struggle and stress of also trying to shape their body to be a particular thing.
I'm so glad you said all of that. I've been speaking on the podcast a lot lately about how we as fitness professionals really bluntly are doing harm to our clients by focusing on only the external. And when they're always coming into us with these quote unquote problems with their body, and we keep harping at them about what to eat and what to do, and you're right, it's not fixing anything. Not that their body needs to be fixed, but we're only perpetuating negative feelings, and making exercise really inaccessible to people. And as you said, like for your population, especially for moms, there is so much pressure and stress already. I wanted to ask you about the pressure moms feel to, quote, get their body back. Can you be a little more specific about how that affects people in the postpartum period, physically, mentally, and emotionally?
Yeah, and that is the thing. It really does affect them physically, mentally, and emotionally. It shouldn't be surprising to us that we have such high numbers of postpartum people who are struggling with their mental health when they are trying to live in this society that does not support them, particularly as we've been experiencing the pandemic over the last year plus. The support they are receiving is not enough in any facet. And then we're also telling them that their body Now, postpartum on the other side of a pregnancy is not worthy. It's not beautiful. It was miraculous when you grew that child, but now it's something to be fixed. It's really miserable for people. And so I think that in the work that we do with postpartum people, we're just always trying to question their stories that they have around their bodies and the beliefs that they have about the size and the shape of it, and really start to try to pull that away for them. And I always joke that I basically just coach in questions now. So it's just a lot of why? Why are you feeling that way? What is coming up? Why is this the story that you're telling yourself? Is this working for you? Does this feel good? Is it benefiting you in any way? What is it? And then we just try to keep getting to more answers.
Yeah. Getting down to that root issue, the root of the struggle. Yeah. There's always something behind the desire to lose weight.
Exactly.
Deep to find it. Yeah. Okay, so let's chat a little bit more about body image, particularly for postpartum people, because I'm sure most of the moms listening know that or understand at least that they should be careful returning to fitness. But it can be really difficult at the same time to accept the physical changes that have occurred in our body. And that can then lead us to want to diet or exercise with intensity that we're not really ready for. So talk to us about how postpartum people can begin to feel better in their bodies after pregnancy without focusing on fat loss.
Yeah, I love this. And this is, again, how we approach fitness coaching for postpartum people in my work, is that we do not tie it to the physical body composition whatsoever. Of course, we have lots of conversations around people if they're experiencing discomforts around what might their body be looking like or the composition of it right now. But we know, and they know coming into our coaching, that we're not going to teach them how to lose weight or to make their body smaller. So I think for the people who might be listening in, it's just, if you can continually remind yourself and do a lot of self-talk around that exercise, perhaps right now even, is not about changing your body composition, and it is so much more about how you feel inside your body, and trying to return or gain some level of function that you want for yourself, that can offer some relief for people. So just knowing that this body has endured a lot through the stress of pregnancy, through the birth that you have gone through, whether that was a vaginal or cesarean birth, there are trauma that can occur physically to the body that we need to heal from. And that can take a significant amount of time. And by no means does that mean we don't exercise through it, but in fact, that movement can be really supportive for that healing process of the physical body. So we really try to put the focus on how people are feeling inside and within their bodies. So whether that is their core or pelvic floor function, whether that is in symptoms or pain that they might be experiencing, how can we use movement to really support them in that, to support them in their healing from birth, whether it was a vaginal or cesarean birth. Exercise and movement can be really supportive for the physical body. And then also for one's mental and emotional health postpartum. And we know that one's pelvic floor health is so tied to their experience of their mental health postpartum as well too. So we really try to get people feeling better in their bodies and having their bodies function as they want them to in their daily life and the activities they want to do with their body, so that they feel truly well.
Mm-hmm. Okay. So talk to me about diastasis recti. And for the moms listening who maybe aren't familiar with that, that's the separation of the abdominal muscles that can happen after pregnancy. Now, I certified in pre and postnatal fitness back in 2015. And back then, diastasis was seen as this big, horrible thing that happened to people after pregnancy. And you had to fix it before you did anything else. And it was like, I don't know, there was almost like shame and stigma around diastasis. But I think things have changed with it. So can you fill me in on how what the current approach is to diastasis recti?
Yeah, totally. You're so right. The information and studies on diastasis has just changed so dramatically, especially within the last 5 years. So, yes, quick primer, diastasis recti occurs in most every pregnant body, and it's a very smart function of the body. So, just know that it's your body really doing what it needs to do in order to allow your baby to grow closer to full term. So you have this connective tissue, soft connective tissue that runs down the midline of your belly from your sternum to your pubic bone. And that connective tissue will stretch throughout pregnancy and can persist into postpartum. And that is what gives this separation of the abdominal muscles, your rectus abdominis or your six-pack muscles that run down the front of your belly. So it is very, very common and a normal experience of pregnancy and postpartum. In many postpartum bodies, it heals super well naturally on its own. Sometimes we need a little bit of TLC or some exercises in order to help it perhaps heal a little bit better. And basically, yes, what we used to think was that any separation that persisted postpartum was bad and need to be fixed. And what we know now is that it is simply untrue. We can continue to have a separation between the abdominal muscles, and that core, that abdomen can be strong, can function well, can help us do all the exercises, workouts, activities that we want to be doing. So we're not as focused on that gap or the separation between the abdominal muscles. We're more so looking at the function of the whole abdomen and the tension or density that is within that linea alba, the connective tissue. So if we are able to generate strength through there, that's great. Sometimes in people who might have a larger diastasis, that connective tissue will stay very weak or very soft. And that is when you might need some support in helping that to function better. But again, for a lot of people, just know that if you have a separation between the abdominal muscles, that might be absolutely fine.
Mm-hmm. Well, that's really liberating because you can spend a lot of mental energy and a lot of physical energy trying to fix something that perhaps maybe isn't even fixable right away.
Yeah, totally. And we see this, ties so intimately to conversations about body image postpartum because people think that this round, soft belly is a result of this diastasis that needs to be fixed. And often it just isn't. Often it is that this is how your body may have changed from a pregnancy. This is how the abdominal muscles stretched. This is more fat on your body than was there before. And all of those things can exist and stay and be fine.
Mm-hmm. I love that. Okay, so we were talking about how it's just more important in the postpartum period to choose movement that feels good physically, mentally, and emotionally. And let's face it, time is precious for most everybody, but particularly when you're a mom and have little ones around. So there's only so much time for self-care and fitness to go around. So if we're working on a limited time budget, what do you think is the most important thing for moms to focus on in terms of movement?
Yeah, I think always it will be whatever brings you joy, whatever you like to do, whatever you want to do. I will say that I'm super biased in that I coach and teach strength training exercise, and I love strength training myself. And I just think it can be so accessible and so modifiable to most everybody that I love it for moms. It's something that they can do with their kids around when they're screaming at you for the seventh snack of the hour, that you can do with minimal equipment from your home that you don't need to go to the gym for. So I love strength training, exercise, lifting weights, resistance training. And yeah, it has been a thing that a lot of my mom clients have been able to make work on a very limited time budget.
Mm-hmm. Awesome. I love strength training too. I feel like it biggest bang for your buck, I guess, is how I would describe it, right? You can do a lot in a little bit of time. You were talking about the pelvic floor earlier. So would you say it's the focus has maybe shifted from where it used to be diastasis was the most important thing to think about after pregnancy to now we know like pelvic floor health is what's really important. Am I right on that one?
Yeah, I would definitely agree with you there.
Okay, so what might a woman do to start repairing or just ensuring the health of her pelvic floor?
Yeah, so I think that it can be so useful if you're able to access a pelvic floor physiotherapist, and that might be something that you've never heard of, or maybe you've already talked about it on the show before, but a pelvic physio is a regular physiotherapist that is often covered by people's benefits if you have those. They just have specialized training in the pelvic floor. So, your pelvic floor muscles are the base of your pelvis. It is a structure of muscles and connective tissues. And like we were saying previously, there can be some trauma that occurs to that region of the body through pregnancy, through your birth, even if you did not birth vaginally.
Mm-hmm.
So I think that that is important for people to know as well, that even if you had a cesarean birth, there's simply a lot of stresses that come from that procedure on your body. And I say that having had two myself and needing some pelvic floor physical therapy to help me along. So if you're able, book an appointment with the pelvic physio. If not, totally fine. So much we can do. The number one most important thing is get to know where that place in your body is.
Mm-hmm.
I think that we don't often know what it feels like to be able to contract our pelvic floor muscles or to release your pelvic floor muscles. And those are both really important actions for your body to be able to do. When you hear about fixing pelvic floor weakness or eliminating your incontinence or your leaking by doing hundreds of Kegels per day, please don't. Please. Exactly. Perhaps what is more important than doing Kegels is learning how to release tension from your pelvic floor muscles. So go learn how to do that. And we can also put some stuff in the show notes of this episode if you want some resources on that. But yes, understand the function of your pelvic floor muscles is to, yes, help you to empty your bladder, help you to have bowel movements, help you to keep your pee and poop in when you want it to stay in, to support your sexual pleasure and function. The pelvic floor does a lot of things. It is not only about doing Kegels.
Mm-hmm. So glad you brought that up because I think that's another thing that's really changed over just recent years, even. My children are anywhere from 4 to 17. And I think it was only in the last one where that's not been the main recommendation.
Yes. And also know that even if you maybe don't think you're having pelvic floor symptoms, like you're not leaking, you are not having any bulgy sensations in your pelvic floor, that's great. There might be some other symptoms or pain you're experiencing that could be related to the pelvic floor. And that could be chronic low back pain or pain in your tailbone or in your SI joints. Or even if you're feeling pain during intercourse, penetration vaginally or anally, there might be some other stuff that's coming up that's related to your pelvic floor. It's not just leaking pee is the only thing.
Oh, that's so good to know. Yeah. Thanks for bringing up those little red flags to be aware of. That's helpful. And yeah, we'll put the links to those resources you mentioned in the show notes. Absolutely. So obviously there's a lot more to postpartum fitness than just what's going on in our physical body. We've talked a bit about that in length, but how can we as professionals, as trainers, begin to look at the whole person to best support them during this time in their life?
Yeah, it's a big question, and it is so important because we know that the pelvic floor, just for example, doesn't act in isolation. It's not that our fitness coaching client is going to come to us leaking during skipping or jumping on the trampoline, and we'll have them do 100 Kegels a day, and that's going to stop their leaking. That might work, but it also really might not be the whole scenario. We need to look at their whole body. We need to look at their breath strategy, their body position, their tendencies, but then also what is impacting them in the rest of their life. So, what's happening in their personal world, in their professional life? How do they handle or manage stress? What are the impacts that are occurring on them? We have to look at the whole person, how they feel in their body, what they think about their body. All of this stuff needs to be tackled to help our clients reach quote unquote optimal core or pelvic floor function.
Yeah, I love that. And for me to like, I think it's so important to remain sensitive to not just like how the pelvic floor is functioning and how that impacts their mental and emotional state, but just all the other stuff like we talked about earlier that they're coping with during this time, and how we really need to take a step back as fitness professionals and not talk weight loss. Like you say, just we're doing harm when we're only focusing on the external, the aesthetics. So on that note, I know that you work with postpartum people, but you also work with fitness professionals. You have a training, a certification course for fitness professionals that want to get certified in a non-diet approach to postpartum fitness. Can you tell us a little bit more about that side of your work?
Yes, so that is called the Postnatal Fitness Specialist Academy. And exactly what you said, within that, we are working with fitness and health professionals from a variety of modalities, helping them understand and have the education and skills for working with postpartum people in their fitness and pelvic health from a non-diet lens. And so within that, we talk about coaching someone in their return to exercise postpartum, getting them back to running, helping them with their pelvic organ prolapse, their diastasis recti, their incontinence, helping them release some of the discomforts that they're feeling within their body image. And all of that, we take a really holistic viewpoint from. We're talking about diet culture. We are doing anti-racism work. We are talking about anti-fatness. We are talking about postpartum mood disorders. We're talking about the patriarchal conditioning of mothers and women, and how we have to have a grasp on all of this stuff to work with postpartum people. So within the academy, I am coaching within it, but then we also have a bunch of guest lecturers who come in and teach on these topics, because I am, of course, not an expert in all of these realms. And I'm also limited, and I recognize my limitations based on the life that I live and the body privileges in which I live. So we need to hear and learn from people who are different, who are living in different bodies, who are not a straight-sized white woman living in Canada.
Mm-hmm. That sounds like a very well-rounded, comprehensive, impactful course that would really change the landscape around how we approach fitness in the postpartum period.
Yeah, and it is. We've been doing this work for almost 5 years now, and we have had 500 plus students through the course. And I see the work that they're doing, and they are changing their industries, whether it's in fitness or physio or athletic therapy. The conversations that they're having with people are deeply powerful, and it is such a joy to watch.
Oh, that's amazing. So any fitness professionals who are listening today who are interested in or who work with postpartum people and are interested in non-diet certification, I have a link in the show notes where you can get more information about Jessie's certification program. So please check that out. Jessie, I have really enjoyed this conversation with you. You are so knowledgeable in your field, and thank you for sharing your wisdom with all of my listeners, particularly the moms in the group. I can't thank you enough for being here with us today.
Thank you, Kim. I really appreciate it.
Yeah. Before we go, can you just tell our audience where they might connect with you? Because I'm sure they're going to want to check you out and follow along and see all the amazing things that you're up to.
Yes, thank you. My website is jessiemundell.com. And then I am most active on Instagram at Jessie Mundell, Facebook at Jessie Mundell. And then I also co-host a podcast called To Birth and Beyond with a pelvic floor physiotherapist. And yeah, those are the main places.
Fantastic. Well, everybody, I'll have those links in the show notes too. So please go check Jessie out. And thank you once again for spending time with us today, Jessie.
Thank you.
Okay, friends, there you have it. I hope that has given you lots of food for thought and given you some new information that you can use, especially if you're pregnant or postpartum person and wondering how you can safely return to fitness. I have linked all of the information that Jessie provided in the show notes, so you can go check that out. And if you are a fitness professional who works with pregnant and postpartum people, I highly encourage you to look into Jessie's certification program. If you're listening to this in real time, in June of 2021, her program is starting soon. So there's a link in the show notes where you can go and learn more about that program. I think we as fitness professionals really have an obligation to support the whole person when we're working with people, and focusing only on aesthetics it's not helping our clients. So, when we can find education from the non-diet perspective, I think we owe it to our clients to soak that in. So go and check her out. I'll see you back here next Monday for another dose of non-diet motivation. In the meantime, I love to stay in touch, so you can get in touch with me on my social channels. I'm at Radiant Vitality Wellness on both Instagram and Facebook, or you can learn more about how to work with me on my website, which is www.radiantvitality.ca. Thanks so much for hanging out with me and Jessie today. Really appreciate you being here. You guys mean the world to us. I'll see you back next week, and here's to your Radiant Vitality. Thanks for tuning into the Power in Motion podcast today. If you love what you're learning here, then I invite you to take the next step of embodying these concepts into your own life so that you can live your healthiest, happiest life and never again feel held back by your body. Coaching is the fastest, most efficient pathway to taking what you know in your head to actually applying it and seeing results. Whether you're looking to make changes around movement, food, body image, or all three, I'm here to help you nurture a kind, respectful, and trusting relationship with your body so you can feel your very best. Click the link in the show notes to book a free consultation, and together we'll uncover what's getting in the way of you having the results you want. You'll leave this call knowing exactly what you need to work on, and together we'll explore whether one of my coaching offers is a good fit for you. I can't wait to meet you.